So to close out the future of pharma, this is probably the most, I think, one of the most exciting transformative talks we're going to have here this week. We've had a lot of amazing elements, but Alex Z, I won't try his last name, I met in London a few months ago, and he is the founder and CEO of an amazing company called Insilico Medicine, and they are really bringing artificial intelligence and AI to drug discovery and through blockchain together to really, I think, change how pharma is done. Alex.
Thank you, Daniel. Great pleasure to be here, and I'm going to be talking today about several technologies that are exponential. So all of them are exponentials, and they are going to be transforming pharma. At the very least, they are transforming my life. So I run a smaller company in AI called Insilico Medicine. My background is in GPU computing, and I've never before believed that I will be standing here in front of you with some of the most and hottest advances in several areas of AI and blockchain. So AI is transforming the way we discover drugs. AI is transforming the way we do biomarker discovery. And very soon you're going to see AI converging with blockchain technologies to give you access to your own data, ensure that you have control and total ownership of your data. So we are moving towards a data-driven economy. And I'm going to be talking about some of the novel strategies for rapid validation. So you hear a lot about AI. A lot of that is primarily because in order to fundraise nowadays, companies need to use that word. And some of that is not true AI. So the real hype in AI comes from deep learning, a technology where you've got major advances and superhuman accuracy in many tasks. That is the technology which is currently powering autonomous cars, transforming art, transforming the way we assemble, manufacture, and play video games. This is the technology that is going to revolutionize drug discovery. And I'm going to be telling you why the time is now to introduce deep learning into your drug discovery pipelines. So one of the people who I admire and I'll try to learn from, it's very difficult to learn from geniuses like that, is the CEO of NVIDIA. I think this is the CEO of the century, and that's probably, well, Steve Jobs probably did a better job, but he still has some time. And he transformed his company several times, and a few years ago, he bet his company on deep learning, and the bet paid off. So I highly encourage you to go and watch the two keynotes from 2015 and 2017 when Jensen Huang gave keynote talks. So his last keynote talks this May generated 12% increase in stock price and it's $12 billion in shareholder value. Just the keynote talk, 1.5 hours. So if you're running a pharmaceutical company, think about that. And he covers all of those advances in modern AI or next generation AI. And as I've mentioned, deep learning really surpassed human accuracy in many tasks. Now you can describe images with superhuman accuracy, even low-resolution images. And that revolution really started around 2014, 2015, after the ImageNet competition. And Andrei Karpathy, who now works for Tesla, previously worked for OpenAI, really opened our eyes with pictures like that, where you have really accurate descriptions of images. Superhuman accuracy, and also superhuman accuracy in playing all kinds of games. So now you see this revolution coming into medicine, and you see it and believe it. So papers in Nature showing superhuman accuracy in our dermatologist level accuracy in classification of skin images. And of course, this industry is transformed by deep learning. You know, Tesla is already putting cars on the street. 3-year, 4-year-old technology is already carrying passengers from point A to point B at 100 miles an hour, and one mistake and you're dead. But people are trusting this life to this technology. So why don't we do it in pharma? And you see that even governments are now competing. When they see it and believe it, they are competing for leadership in this space, and they're willing to change regulation. So lots of countries worldwide are opening the roads for autonomous vehicles and opening the legislation to be more autonomous driving friendly, to ensure that they don't lose competitive advantage in autonomous vehicles. And Michigan just passed some of the friendliest legislations possible in AI for driverless cars. So pharma is also going to be transformed. And in the US, the FDA is looking into this issue. And one of the countries which is leading the way is Korea. And also Taiwan, China, those countries are looking at the legislations to find new ways to accelerate the pharmaceutical drug development process using AI. And we just recently presented to the Korean Ministry of Food and Drug Safety and a few other regulators. So I think the regulation is going to change, and for a good reason. So out of all the industries you know, pharma is perhaps one of the most inefficient. And the productivity in this industry is going down. So it costs more than $2.6 billion to develop a molecule into a drug, and there is 92% failure rate. So there is lots and lots of room to get going for AI to transform things. But pharma is not very good at sharing data. So whatever they talk about, innovation, external innovation, internal innovation, this innovation is not going to come from inside. It's going to come from companies like us. And there is lots of public data available. So this is the resource from Cognitive. I also run this resource, which tracks government money going into all kinds of areas of biomedicine worldwide. And we can see that $20 billion were invested in just high-throughput screening experiments worldwide. This figure is pretty much stable at about $2.5 billion a year. But you can now generate much more data with those experiments per dollar. And we are using this data to train our algorithms to essentially come up new molecules faster than pharma does. So I think this area is going to be the most disrupted by AI within the next 2 to 3 years. So if you're working for a pharma company and you are still thinking, okay, where is the proof? Once there is a proof and once you can see it to believe it, it's going to be too late. So you're going to get outcompeted by these companies. And this slide has been shown several times during this conference, CB Insights. More than 100 companies started just 4 or 5 years ago. Many of them are doing kind of more classical AI. Some are in deep learning. Some are really good, atom-wise, Numerate. There is a whole community forming around this space. And these are the next disruptors working with pharma. And now the Wall Street is noticing. So lots of money is being thrown at those companies. And you finally see that the pharmaceutical industry is starting to take this new field seriously. And there is a paper in Nature Biotechnology that just appeared this summer that summarizes the deals that were made by Big Pharma with the smaller AI companies, including ourselves. And previously, in 2015, 2016, pharma companies were talking about smaller pilots. You have to see it and believe it. Very tiny projects. Now they're talking about new models for licensing. So a company called Exponential out of Dundee just closed a $250 million euro deal with Sanofi. Big, bold move by Sanofi. Great big hand to Exponential. We don't know much about their deep learning expertise, but they are great at business development, and they managed to set the price tag. So now a lot of investor money is going to be pouring into this industry. So Numerate also just struck a deal with Takeda. And GSK, one of the very, very disruptive, I would say, companies looking at AI, just made a deal with Exponential as well and announced the price tag. They also did a deal with us. And there are also new models like Calico. So Google is investing, and they are bringing AI to the table, and they are doing drug discovery. So maybe they will be the next disruptor. There is also a company called Juvenescence, which just recently, this summer, they got together with the help of Jim Mellon, a very famous British billionaire. And he spent a year touring the labs all over the world, looking at drug discovery and longevity-focused efforts, wrote a book, created a company, brought a lot of funding together, brought some people, including Declan Dugan, who developed Zoloft, Lipitor, and Viagra, drug discovery pioneers, who are now licensing molecules from our company and also developing their own, developing them into drugs. So when these guys come into play, you can realize that it's becoming serious. And this is how drugs get discovered and developed. So you've got a lot of fallout at the early preclinical stage, very famous slide in pharma. So you actually have to start with tens of thousands of molecules to get one drug. and it takes you many years to do that. So very good area for AI to disrupt. And there are two strategies for AI-driven innovation in pharma to ensure that you get better molecules and much faster approvals. So one is looking for a needle in a haystack, and another one is creating a new needle. So our company developed a pretty comprehensive pipeline that utilizes both of those strategies. We start with a large numbers of molecules, large numbers of hypotheses, and then take it through a process that gives us very high quality promising leads that then later we validate and put into partnering and pharmaceutical drug development. But today I'm going to be talking about one technology in AI and deep learning called generative adversarial networks, which is essentially disrupting AI as well. It's a new technology developed proposed by Ian Goodfellow, at that time at Google Brain, now he's back at Google Brain, where the two deep neural networks are competing. One is a generator generating meaningful output in response to, in this case, textual input. And the other deep neural network is the discriminator, which is essentially trying to judge the output from the generator to see if it's true or false. And together, during this adversarial game, GANs start generating new objects in response to textual input that are very impressive. So if you haven't seen this paper, I highly encourage you to go and look at it. But you know, a picture is worth 1,000 words, or in this case, we at Insilico like to say that a picture is worth 1,000 genes. You give this GAN a textual input. Let's say this small bird has a pink breast and crown and black primaries and secondaries, and it imagines new birds. And just in December last year, another group achieved photorealistic quality. So they can imagine new birds, flowers, etc., better than I can, with higher accuracy. So what we did, and we were the first ones to publish and validate, we started employing this particular technology to make deep neural networks imagine new molecules, to make it perfect right from the start. So to come up with really perfect needles. And we were first to utilize the adversarial autoencoders. It's kind of a flavor of a generative adversarial network that gives you a little bit more formalism to generate new molecules de novo with desired pharmacological properties. So you can essentially go to this GAN and ask it to create a molecule that inhibits protein X at concentration Y with the highest bioavailability and specific characteristics and minimal side effects. And it gives you that molecule. So we started a space race for validation. Validation is key. You need to see it to believe it. Then governments will really start changing the legislation, and pharmaceutical companies will start believing in AI. So we kind of borrowed some terms from the Cold War, and very unfortunately, we're kind of seeing this tendencies of a Cold War starting again. But we are trying to validate at every point of the way. So we already validated the outputs of our generative adversarial networks in vitro, so we call this project Sputnik. We have a project called Belka and Strelka, where we're putting molecules discovered using AI into humans already, and we validate them in mice. And we have a project called Apollo, where we're going to actually come up with the first human trial for AI-generated molecules in skin. And believe it or not, we also are looking at molecules that increase human resistance to radiation and hopefully aging. So if Elon Musk doesn't fail us on the rocket, we'll do pretty well on making humans more radiation resistant. We developed our own pipeline of small molecules that we're taking through validation experiments and licensing those molecules. We also coined a new term called xenofibrosis. It's aging-associated senescence in multiple tissues, so we might be able to even reverse that particular condition. And we started looking at various validation strategies that I'm going to kind of switch gears right now and tell you about those strategies. We try to borrow from the consumer industry and get the insights from the consumer industry back into the drug discovery space. So there is a company in the US called Life Extension in Florida. They are one of the largest nutraceutical supplement vendors in the US, 350,000 subscribers US-wide. How many of you are taking their product? Not that many. And they also provide annual blood tests to their subscriber base through a partnership with LabCorp. So we started putting out nutraceuticals that we believe to be potent as cynoremediators, essentially molecules that reverse the senescent phenotype and might be anti-aging drugs, anti-aging molecules into nutraceuticals, and then we're getting real-life data back. So we're asking people to come back with their blood tests, with their pictures, with their other data types to report on how those molecules are working. So it takes us very short time to predict those molecules, put them on the market, and then we take 25 weeks for people to take those molecules, report the data back, and we analyze this data. So that's one of the fast ways to validate. Another interesting story I want to tell you about is a project we are launching actually next week. We're trying to perform human-level validation. So medicinal chemists, when they spend decades looking at molecules, they get a hunch whether the molecule is good or bad. So we're trying to capture this moment with a partnership with a company called Emotive and a website called chemistry.ai. So if you are a medicinal chemist, you can go register, buy a device like that, or we ship it to you from a company called Emotive in San Francisco. So we're measuring your brain activity, we're looking at eye tracking, we're recording a video, and trying to recognize whether you like the molecule or not, and whether you can recognize the molecule that has been created using AI and differentiate from the molecule that has been created by a very experienced medicinal chemist from a high-value library. So next week, a lot of people are going to start using this system and looking at the molecules to see if they can identify our molecules from the molecules generated using other medicinal chemists. And also we'll be able to classify medicinal chemists into various groups to understand human biases. So if there are any journalists in the room, don't write that we're trying to replace medicinal chemists with robots. That's not what we're trying to do. But we want to return the brain activity and the reactions of medicinal chemists when they're looking at molecules back into the generator. So I want to switch gears into another topic. So another area where we're innovating. We are treating aging as a disease for the purposes of training our AI, and I'll explain why. So everybody in this room has aging. So everybody is aging. So if I train the deep neural networks to accurately predict your age at every level with using multiple data types, so some abundant data types or some more rare data types, the deep neural networks start learning the biologically relevant features that contribute to your aging process. And I can train those networks within every data type, understand the most important features within every data type, possibly identify targets or pathways that I can target to make you look younger, and I can integrate those features into a highly multimodal deep neural net to predict your age. And after that, I can do it very quickly because there's lots of data available with age. And then I retrain those networks on patients with specific diseases, like Alzheimer's, Parkinson's, diabetes. So I don't need that much data, patient data, to train those deep neural nets anymore. And that comes from a technique called transfer learning. And you probably have heard about terms one-shot learning, zero-shot learning. So if you can recognize the age of each monkey in this picture pretty accurately right now, that's zero-shot learning. You have never seen a Japanese snow monkey before. And you can probably guess that those small ones are about 1 year old. The older monkey is about 8 years old, 10 years old. So you'll be pretty accurate without ever seeing those monkeys because you trained on a lot of human data. And if I show you 100 monkeys, you'll be able to do almost perfect. So you'll learn from a much smaller data set. So this is what we're trying to do when we're training deep neural nets on aging as a disease and then retraining on other conditions. So because we learn the very biologically relevant features. So that gives us also a question, what data type is more valuable? You know, your genome or your facial photo in high resolution or your selfie? Because from your genome, you can derive many features listed here. From your picture, you can derive all those same features. Plus, you can get age, weight, height, skin health. You can get some syndromes in certain cases. Many of you can recognize Down syndromes or Hutchinson-Gilford syndrome. Very easy because you can see it to diagnose it. You can even diagnose social status because if the person is wearing a suit, most likely the person is not homeless, and if the person is wearing a gold chain, probably he's well off. Glasses might be a trace of intelligence, so you can actually get lots and lots of features from a selfie. And that kind of brings you back to the value of data. So if I take a picture of you and take it, who owns this data, right? And if I train on this picture, I actually get a lot of valuable information now. If I'm an insurance company, I can use this information to discriminate people. And I want to ensure that you can use this data as data donors. If I take a picture of you right now, I want you to own it. And we are working with several companies to understand the value of these data types. We want to understand how those data types can be linked together by guessing your age at every level and looking at what interventions make you older or younger. Lifestyle choices. So we just recently launched a system called Young.ai, where you can upload your facial pictures, your hand pictures, your any data type. And at this point of time, you can upload your blood tests and see whether we can guess your age. So if you look significantly older than your chronological age, don't be surprised and don't run to a doctor. Maybe there is nothing there, but maybe there is. And the pictures actually give you a lot of information. So we are trying to get them consistently. I guess nobody else here has selfies collected over time, specifically every day, and annotating your current health condition. So we partnered with a company called Bitfury. Many of you probably have heard about them. They are #1 outside China in blockchain technology. They put governments on blockchain, government of Ukraine, government of Georgia, working with large financial institutions. So we want to understand the value of human data and also return the ownership of your life data back to the individual. So we asked a question to Bitfury, and together we brainstormed a lot since January this year, whether you can pay people to take medical tests. So instead of people paying for medicine, they can get paid to get diagnosed. Can we pay people to stay healthy? Can we reduce the gap between the rich and the poor? Can we turn Africa into the next Saudi Arabia of data? Can we turn this into a data factory and solve global hunger? Can we create a health-driven economy? And those two ladies in the middle, they came up with a paper which is going to be published this week or next week. It's been accepted and in production on converging blockchain technologies with AI. And this convergence will allow you to create decentralized marketplaces where the FDA can get involved, private companies can get involved, pharmaceutical companies can get involved, and the individual will own their data. So I've been talking to a CEO of a company here at this conference, which is collecting a lot of data from consumers. So you can essentially submit a sample, they'll profile it, and then they'll do something with it. And I asked him, okay, so can you actually, as an individual, can you request this data back? Or can you get this data deleted? He said, no. We're keeping the data. You cannot own it. So we want to ensure that it doesn't happen, that the market is fair and you can get this data back. And that's why we're introducing a new system on blockchain AI, new marketplace. The prototype is already ready, where you can, just like you are doing this for guessing your age, you do this for earning cryptocurrency, crypto token called LifePound. And we came up with new concepts called combination level of data. So, if you combine your picture with your genome, this combination is worth more than each data type separately. Or if you have time series data, this data is worth more than the same data coming from different individuals. So this marketplace is going to be operating starting probably January this year. And I'm sorry I'm a little bit over time. I hope I don't miss my flight. I encourage you to come to our annual conference, annual aging conference in Basel, and our second annual conference on AI and blockchain for Drug Discovery Forum. And again, I guarantee you that within the next 5 years, AI and blockchain are going to be disrupting pharma. So it's a very good time to get in. It's also the most altruistic cause, if you think about it. Thank you very much. Daniel?
Catch your flight. The AI told him his flight is coming, so he needs to leave. Thank you, Alex. That's the tour de force.